Hello, everyone. Today I am talking about clinical report writing. This PowerPoint was developed by Dr. Mary Dale Fitzgerald. The clinical report writing that you will be doing in your first clinical camp will be pretty much directed by the clinical supervisors there. But I just want to give you some general ideas about clinical report writing. They will have specific forms, and they will go over each of those forms at your orientation. And if you have questions about the forms, I am sure your supervisors will individually help you to understand the forms. Many of the forms are self-explanatory by just looking at the questions and kind of knowing what those mean. But however, those of you who have never been on a clinical setting, who have never worked for the schools, those forms may be a little confusing to you at first. I am definitely asking all of my students who have some experience in the schools or in a clinical type setting to please help your classmates, to please work closely with your classmates to help them understand some of the writing aspect of it. Because clinical writing is a little bit different than just whenever you're writing an essay, for me, on a test. Okay, so here are some standards for reporting. You must have a record-keeping system. These are standards for maintaining a client files. So there must be some organization within the record-keeping system. Things must be dated authorization. So you will have, you may have on this one clients to sign forms to be tested with parents. But because of the setting you're going into, that may have already been taken care of because you're going to the daycare setting. But in your second clinical practicum, the parents will be coming with their kids, with their children, to the clinic, to our speech and hearing clinic, and you will go through with them about signing off on authorizations and different forms that they will have to sign. So that will definitely be something you will participate in more actively next year. However, this year there were dated authorizations for these children to be screened because you just can't go into a daycare and start screening without a parent's permission. There must be somewhere in the file EPB knowledge about the disorder area. So if the disorder is language, then you have to provide some evidence in which your diagnosis was based. And you will learn more about how to do that. Let's go down here. Let me get my arrows. I always say that I never have my arrows ready. Okay. Let's skip down to this. You won't be doing the ICD type of billing codes, that kind of thing. Those are really easy, so don't get intimidated by words. And many of your jobs, they will train you on how to do that. But I do know on the second camp, you will do more of the ICD, more so than this camp. The nature of treatment procedures using CPT codes and results must be documented. The nature of treatment procedures. This is more for the second camp, so let's skip over that one. And then this one you may have to do, depending on the forms that Dr. Watson gives you, the type of service, which would be whether it's speech or language or voice or swallowing, the frequency of delivery, which is 2 times a week, 3 times a week, once a week, whatever that is, and the duration, your best guess of what the duration might be, 3 months, 6 months, a year, in terms of duration of therapy. That is flexible. That could change depending upon the client's condition. If the client has great progress, then the duration may be less than 6 months. They may actually get better, prior to what you expected. And then for others, you will have to either reevaluate, rescreen to document that they need further treatment. Okay, there must be some policies and procedures for reporting, and that will be set up by your clinical supervisors and by the orientation that you will receive on Wednesday. If you do any screenings, you must document those, and those are written up in your reports, and the form in which you did the screening will be placed into the client's file. Case records containing identification data, referral sources, evaluation reports, treatment plans, dates of service, and progress reports all must be in the client's clinical files. And reports should be in compliance with preferred practice patterns. Preferred practice patterns all that means is what the field generally does. So for articulation, straight artic, no phonology, the field will do a traditional articulation therapy where you're showing the child where to place their lips. That is a preferred practice. A preferred practice for a child who may have phonological errors, then you would choose one of the standard phonological treatments. One would be, the HOTS, and there are other phonological treatments as well, but you do the preferred practice patterns for the profession, and you can look on ASH's website and they, document what those are. I'll give examples of some of those. But generally, what the speech supervisors are asking you to do, then that is generally the preferred practice, because preferred practice means what speech pathologists, current practicing speech pathologists are doing. And this is within evidence-based practice, whether it's research evidence or case study evidence. So let's suppose there's a new treatment out there, then they don't want you to just start doing the new treatment just because you went to a workshop. You want to look it up, you want to investigate, you want to think about it, that type of thing. Okay, HIPAA and FERPA standards. HIPAA is a federal law which requires that each covered entity maintains or transmits personal identifiable health information to maintain reasonable and appropriate safeguards. And we do that in our clinic. We decided in our clinic that we will follow the HIPAA policies, even though I think TSU has designated itself as not necessarily a covered entity by the federal law, but in terms of our clinic, we do practice the HIPAA policy standards. And the FERPA standards has to do with the educational, so you're going to get a lot of educational reports from schools. So you want to make sure that those special educational records and assessments are also maintained and safeguarded to maintain the privacy of the individual. So those are really, really important issues. So do not lay reports around. Do not have reports just lying around with the person's name and identifying information. You need to keep that in a separate, safe place that is locked away, and then you can make, a copy or something of the report of the test, but white out the name if you're needing to look at it longer and, think about it and you want to take it home. They should not be taken home, not the original form, after you've done it. But if you need a little more time to think about it, then you may ask your supervisors, and maybe you can take the test booklet, a copy, but of the parts that you need to analyze, but no identifying information, so that you can spend a little extra time thinking about what you want to do with the client. I don't think this year it'll be that difficult. The next year may be a little more difficult because you'll have 3 clients individually, and you'll be responsible for writing up goals and coming up with ideas. The TSU clinic will make its FERPA and HIPAA privacy policies and procedures available through a notice of privacy practices, and it will be distributed to the clients who are receiving our services, and a copy of the notice posted in the main reception area of the clinic. And that is definitely seen, and then the client will sign a consent form. There's a HIPAA FERPA consent form that clients sign. Now, that may have already been done for you in this case because you are going to the preschool clinic versus them coming to us. Now, you cannot release information unless you have gotten permission from the client to release information. And if you to obtain information about the client from a hospital, a doctor, or a school, or any information, then the client has to sign a release granting you that permission to obtain that information. Okay, you do not use patient names on clinical supervision documents, even the ones exchanged between students and supervisors, because you're going back and forth revising the report, so it should only be an initial up there. Usually initials are placed on the reports because the supervisor will give you back the report and say you need to redo, then you need to redo the report. So that's a lot of paper going back and forth. So we want to make sure that a piece of paper that is lost or somehow dropped, an identifying information will not be on that piece of paper. So many times people put initials, so make sure you do that. You will hear this again, and we say this again and again and again because it is so important. So don't think to yourself, oh my gosh, I'm hearing this again about HIPAA and FERPA, and you're going to hear it again in orientation, and you may hear it again next year as well, because that is how important this is, okay? You don't want to discuss information over the phone because you don't really know who you're talking to. I really don't like discussing information over the phone with anyone, unless they can give you some identifying information over the phone that is the person you are talking to. Plus, you have to have written permission for that information to be dispersed. So just be, or express permission, but make sure the express permission is from the appropriate person. So express permission. Okay, so the summary of this: make every effort to ensure effective open communication with your client and their family members. Strive to obtain truly informed written consent, truly informed. Some people sign papers they don't know what they're signing, and that's not really informed. We want to make sure that we're not trying to trick people here. We want to make sure that people really understand what they're signing. So please, just make that your duty. When in doubt, ask yourself, how does this action affect the welfare of any student or client? So, yeah, how would I want my child to do this? Would I want this to happen? So you want to become knowledgeable and keep current on legal standards of confidentiality, and you always you always seek to protect the client. Well, why do we write reports? We write reports to inform. We want people to know what is going on with their child in a professional sense. We also want to let other professionals who may be working with this child to know the child's strengths and weaknesses. So the primary purpose is to inform. You also, as you write your report, you have to write it in a way that is professional, but at the same time, when you discuss it with the parent, if you think there are some literacy issues, or if the parent informs you there are some literacy issues, then you may want to explain the report to the parent in a very simple but not insulting terms. Many parents want to know, does my child have a problem? Yes, your child has a speech problem. Can my child be helped? Yes, your child can be helped, and we're going to do this, and we're going to do that. They may not understand reliabilities of a test, or what receptive language versus expressive language and auditory comprehension and those kinds of words, but you can break it down to them and they already know. That's why they brought their child in to you. They know that their child is having some kind of problems, and you're confirming to them, yes, they're having some problems with following directions. They're having some problems with producing these particular sounds, and I am able to help them, or not. The clinical report will identify the purpose of the report, and the purpose of the report is to, diagnose, to determine whether or not there is a speech or language disorder. Now, reporting is an art, so there are some different styles of reporting, and your supervisors are going to have different styles, and I ask you to respect each supervisor and each supervisor's style, and can be accomplished by qualified examiners who are competent in reporting pertinent information to appropriate referral sources, and who understands the feelings of parents who must receive the information. So also be careful in your writing. You may not want to say that this child is a behavior problem. You may want to say something like this: this child was non-compliant in following directions for the test. that type of, just word it, a little nicer, but saying the same thing in a professional way. Now, if you have to write a diagnostic report, then you want to read sample reports and get an idea of the format of the report. You can work from an outline. Usually there is an outline that they will give you of what they want in the report, or if there is an electronic format, and they will give that to you as well during your orientation. You want to write your report as quickly as possible so that you're not forgetting some of those observations that maybe you saw. You want to read your report aloud to yourself, because sometimes reading it silently you fill in the words, but if you read it aloud you will see that you skipped a little word. And you can also hear that it doesn't quite sound right. It might not sound as smoothly. There may be a grammatical error. So do that. Read the report aloud, check for accuracy, and improve some of your style writing. Read the report aloud again and see if that sounds even better, and then make your final corrections. Print, sign, and date report. Now what you will do, you're going to do your draft. You're going to read it aloud, right? Or read it to one of your classmates and say, oh, does this sound okay? Then you're going to give it to your supervisor. And she's going to revise. She's going to say, oh, revise, revise. Or she may say great. But most of you will get revise, revise. And so you're going to improve it. And then you're going to read it aloud again. So make sure that you're actually taking steps to improve your report writing with your supervisor. Make sure that you change the things that she has asked you to change, all right? That will make life easier for you and easier for her. And you'll be more efficient in getting your reports back to you, and you can get them done quickly, and you get them done and go to the next step. So make your final corrections, and then once you do your report, your supervisor will then tell you when it is time to give it to a parent, a copy to the parent. Okay, because in the end, it is your supervisor's client, not yours. It's your supervisor's duty to make sure that things are done in a way that meets the standards and qualifications of a certified speech pathologist presenting that report. So you need to definitely listen and respect the speech supervisor. You want to use appropriate terminology as it related to our field. You want to avoid redundancy. Don't keep saying the same thing over and over again, and don't use too many words if those words aren't needed. Limit the sentence length and use short paragraphs. You have to decide what voice. Are you in third person voice, first person voice? Most of the time I think it's third person, but follow the format that you've given at your orientation. Your tense, whether you're in past tense or present tense. Some people go back and forth as they're writing, so you need to make sure your tense is consistent and appropriate for the section that you're in. If you're doing a background, then that usually is past tense, right? But, if you're discussing the results of the test, that may be in present tense. Or if you're talking about the results in the time that you gave the test, which would be in the past, then it would be in past tense. But then what you want to do in the future may be in a different tense. But they will give you examples of the appropriate tense. Proofread for spelling and grammatical errors. You want to plan for in terms of when you think about your writing. You want to prepare by organizing the important information. You want to write your first draft, and you want to emphasize the new information. But the most important thing will be what the parent and the other professionals are looking for. Is what you have to add that is different for something that they already knew. So, your background information, you've gotten that from the parent. The parent knows that. She's just checking for accuracy on that to make sure that you got it right in terms of what she said. And also background information from other professionals. They're going to just check for accuracy, not necessarily. They may read through that very quickly. Then as you get further along in your report, the professionals and the parents are interested in the new information. And that's where you want to spend most of your time making sure that it is written in a very professional and competent way. Okay, revise and refining. You check the content and organization of your writing. You correct and improve your style, correct and improve the format. Usually there is a format that each clinic wants you to have. We have a format in our clinic. And when you go somewhere else to an externship, they will have a format. And when you go to a job, they will have a format. And so you will follow whatever format is appropriate for the job. Consider from the reader's point of view, can someone understand this who wasn't there in that room with the child? So maybe you can ask one of your classmates to read it who didn't see you give the screening and ask, okay, can you tell what I've done? Was I clear? That kind of thing. Check for your sentence structure and check for the logicalness of the order. Did you repeat the same thing 3 times? If so, don't. And then ask a peer mentor to read. There are several types of reports that you will have to do as a speech-language pathologist. You have to do diagnostic reports. You have to do SOAP notes. You'll have to do facility-based reports. They'll have their own forms. You have to do treatment plans. You have to do IEPs if you're in the school system, progress reports, and then you have to do discharge reports. So there's all types of writing that has to be done in the field for documentation. Well-written evaluation and treatment reports and progress notes or SOAP notes are essential. Information gained is of little value until it has been accurately documented. Familiarity with report writing styles is essential to executing a well-written report. You want to plan, you want to prepare, you want to write the first draft, and you want to revise before producing a final copy. Rarely can beginning clinicians write a report the first time and get it right or get it in a way that seems to be organized and appropriate. So be prepared to rewrite and don't be offended. It's called the learning process. It's what you do. I mean, I got so many red marks on my first report. It was awful. But, you just swallow your pride and go on and rewrite it. And it's so you may think it's clear to you, but it's not clear to your supervisor. So it has to be clear to the person who is giving you the grade. Whether it's clear to you or not it can be. It's not all the time, but it can be irrelevant in this case because sometimes we know what we're going to say, but we have not presented it in a written fashion so that other people will know exactly what we intended to say. And that's the key, that's the key. And when other people read it, they need to read whatever it was that you intended to say. So careful attention to all types of clinical reports is important because they form the foundation for the clinical services. They form the foundation for the objectives that you are going to be targeting for this child. And also they serve the foundation to establish the professional reputation of you as a clinician. If you write great goals, you write great reports, oh gosh, people can say, I can really pull goals from this report, from this person's report. I really like getting reports from her. And then there are others, they're like, I have to redo the whole reevaluation because the report just doesn't seem like it's logical. It doesn't seem organized. So you don't want to be that clinician. I found here an example in your content of a SOAP, a brief progress report in a SOAP format. Now this is a progress report in a SOAP format. Our program, I don't think they do progress reports in SOAP format, but they do SOAP reports, like your daily SOAP notes. They call them SOAP notes. So what I want you to do is to sort of look at how this SOAP note was written, just as an example, even though this is a progress report. So your SOAP note may not have as much information. So here we have the subjective part. Mr. Smith was alert and oriented during today's session. Nursing staff reported an increase in the number of hours he was awake. So these are observations, not just from you, but from staff, things that were reported to you. And in his general orientations to surroundings since yesterday evening, Mrs. Smith was present during the last half of therapy and reported that he was frustrated the night before at his inability to find the words. So you know now that the client is experiencing some emotional issues with his inability to communicate. So that makes you either have to come up with, you can stay the course, or you may want to come up with something that might move him along a little faster, or maybe he needs a board. You know, maybe speech isn't exactly what you want to stay on. You want to do a board in conjunction with speech, and that would maybe help with his frustration. So here are some objectives. Mr. Smith pointed to pictures of familiar household items with 75% accuracy. So they give the accuracy in the objective part. When named by the clinician with 80% accuracy by function. He named, he pointed, so this is pointing. So you know here that's receptive. He named, now we're talking about expressive, 20% of the same pictures. And she gave him maximum cueing from the clinician. Now we don't know specifically what maximum cueing means for this clinician, but maximum cueing means for me that, you know, she gave him visual cues, tactile cues, she gave him verbal cues, which would be auditory cues. She gave every cue that she could think of. She written cues that could help him name the picture, and he still only achieved 20%. So it seems like there may be something else going on besides dysarthria. He does have severe dysarthria, but the fact that he could only name 20% suggests to me that there may be some aphasia there or maybe apraxia. Now remember, as you're doing your therapy, you're always thinking about diagnostics. Did I diagnose him in the right disorder? Am I doing the right things? You're always in diagnostic therapy mode. So severe dysarthria persisted. This is objective. It negatively affect his ability to imitate lingual movements. So she had him do tongue tip elevations, lateralizations, and tongue retractions, and they remained slow and labored, which could definitely hinder his intelligibility and his ability to get the words out quickly. All right, so assessment. So now you're going to do just a general, your general findings of that day. Well, for this is a report, a progress report, so it could be of that month. But for you, if you're doing them every day, then it would be your general assessment of that day. Mr. Smith continues to demonstrate severe word-finding problems, which negatively influences his functional communication, and he has limited speech intelligibility secondary to oral motor weakness. So he does have word-finding problems, and he has dysarthria. So they're trying to do an increase in word recognition and overall alertness was noted. An increase in word recognition and overall alertness was noted since the last intervention session. So his general assessment was that he has improved in his alertness from the last session. However, he continues to demonstrate severe word finding problems and severe intelligibility. However, her plan is to continue speech therapy, 30 minutes a day, targeting increased word finding and speech intelligibility. Now, look what she added. This is so important. Because of what Mrs. Smith reported, his wife, that he had difficulty the night before trying to find the right words, she is going to provide a picture board as her next plan of action. Provide a picture board of common objects to facilitate Mr. Smith's word finding when he is talking with his wife and the staff. You want to counsel Mrs. Smith regarding these agents' strategies to facilitate word finding and to repair communication breakdowns. So you can see here they're using professional language, professional terminology that we use in our field, facilitate, repair, communication breakdowns, word finding, speech intelligibility, you know. And so her plan is to continue speech therapy. Her plan is to provide a picture board, and her plan is also to counsel the wife, because that type of teaching and counseling can help for generalization and carryover of activities of what you want the person to do, and also will help facilitate communication. The ability to communicate, that's your ultimate goal, is to make a child or an adult a good communicator, and whether that's through language or artic, whatever is through, your goal is to help the person to communicate. All right. Well, I am done. I suppose there are no questions. If there are questions, please email me or text me. I am on vacation, so I will not be looking at emails until after I get back, but I will respond to a text. Again, for those of you who are in need of who need for me to look at your observation hours, I will definitely do that, but I won't have an opportunity to do that until later tonight. So I will get that done tonight. And so they should be done by the 4th, and for some of you, there's several of them I have to do. So between tonight and the 4th, I should have those done so that you can print out your reports on the night of July 4th or July 5th. Dr. Watson, I've informed her that it is, my fault, and she is willing to let you turn in your observation hours, a little bit later in the day once you get to a printer. There you are on that. If there are any other questions or concerns, please contact me through texting if you want a very quick response. Take care. Have a happy 4th of July, and I will see you when I return on Thursday. Bye-bye.